We've had a library at MCG since 2006, 2005, probably 2005. I joined the company in 2002. First couple of years, all I did was help the editors get their articles, etc. But part of what I did was streamline the job, organize the job. I set up databases. At the time I had that kind of knowledge. Since then I've let it go. And a lot of the work that I did went into the first run through that we had of content tools. The robust content tools that we have now, we didn't have it all when I started. And part of what they needed was something to help. Yeah, MCG prides itself on its most current research and keeping up with what's out there in the medical field, etc. So our editors would do the research, I'd make sure to get the articles. It had to be as fast of a turnaround time as it could be. Back then it was 2 weeks. Now, Cease and I normally have stuff back to the editors within 2 to 3 days, if not sooner, depends on what it is. Our editors do an initial search through PubMed, which anybody in the medical field knows that PubMed is the premier article compilation database, and it's free through the government. It's our taxes at work doing good things. And they do that search, then it comes back to us. But when I started, we didn't have a library to do that. They had an admin assistant, that was me. But it turned out as we went on, I'm saying this needs more, this needs the touch of a librarian. So I went up to Jim Shivanoff at the time and talked to him about it. Well, at the same time, he and one of our editors here were saying, you know, we really need a library. So I went back to school, got my master's degree, and set up the library that we have here. When we started, I had an assistant who helped me deliver articles, etc. Didn't do as much research then because it was not as easy then to obtain articles as quickly as we can now. Even in the early 2000s yet, articles, medical journals were all going more and more online, but it was still half and half. Now we can obtain 95% of what they need electronically, and again, usually fairly quickly. The library started, obviously very small, and now even though it's 2 of us, we handle a lot. We cite, I don't know, I'm trying to remember the numbers.
I know it's thousands, right?
Yes, I'm thinking like 15, 16,000 different individual sources, whether it's a book chapter, whether it's a journal article, whether it's a website, whether it's a special report. Multiply that by 4 to 5. And that's what Cease and I have to handle coming in, because of course our editors read all of these and say, oh no, this one's no good, this doesn't help, we already have this information, we don't need this one. But they don't know that until they get the article and read it. So what we end up doing is getting those. When I was first doing that, we couldn't handle the volume we do now. Now we're always kept busy. The job used to cycle more. It doesn't cycle much anymore. When I started, it was mostly all journal articles and book chapters. Now we have a lot of extra sources that we can go to. We go out to, the United Kingdom has a very good research evidence-based medicine database through their national health system. We access that all the time. We access a lot of the highly accredited information, things like Cochrane Research Reviews, of course New England Journal of Medicine and British Medical Journal. A lot of the good high quality sources, we're out to them all the time, but people like the National Health Service Institute's research is nowhere in PubMed, in a database. Those are things that we have to check into ourselves. So part of what we now do is above and beyond what the editors find in their PubMed searches or their individual searches, is we go out and look for extra. We go out to we go out to the American College of Cardiology or the American Gastroenterological Association, or the American College of Obstetrics and Gynecology, all these different national and international. We also go to a lot of European and English sites for our research, but that's something that we have to do manually on top of. We also, anything that doesn't come through like that, or if we know it's a new guideline that the American College of Cardiology, or an old one that they put out, we go out and make sure it hasn't been replaced. I have to go out and see if it's still something that they're still supporting, or have they withdrawn it, they're no longer supporting it. So I go through 2-3 times a year on all these types of citations just to make sure that we have the most current, or we're aware of what's going on in the field. We can't keep up with everybody, but we do try to check a lot of, we have a list of 20 to 30 medical associations that we check every month to see if they've had something new come out above and beyond what we find in PubMed or in our normal day-to-day research. Another thing I have to do is keep track of books. Oh look, Harrison's Principles of Internal Medicine is a very big book in the medical field, a good basic text for, the journal articles tell you what's going on right now. The basic text still tells you, well, a fever is this and this is what you do with it. The journal article is then going to tell you what happens with that fever and how it's affecting whatever. But we still have to keep up our textbooks and make sure that we have the newest edition of the textbooks. That's a good, between that and keeping the catalog up, etc., that's a good chunk of time at times. Sometimes I don't do anything for a few weeks. Other weeks I'm totally involved in updating book chapters or making sure we have the newest edition of a book, this type of thing. We try to keep ebooks for our editors because it's so much easier for them to access the ebook rather than us sending, and we had to do this in the past, sent 5-6 copies of the hard copy of the book out to editors to have in their homes. And when you're talking $200, $300, $400 for medical texts, that gets expensive fast.
Mm-hmm.
So, that's a lot of what the MCG Library does. Again, we started with pretty much nothing, and now it's a very vital component. Ask any of our editors, and they're going to say, oh, no, we don't want to lose our library. They're too busy. They support us. They keep us happy.